Hello doctor and friends, my name is Delo Putusa Sotasha Udaputri, student number 224, and today me and my friends from SGD B6 will present to you our student project title, Intermittent Exotropia. Next, this is our member. Next.
Good afternoon, Doctor. My name is Ardegita Pramisti, student number 044. Now I'm going to continue the presentation. So, as we all know that intermittent exotropia defined as an outward ocular misalignment and being one of the most common form of strabismus in children and adults. It has been reported more frequently present in the Asian population, with the prevalence of the exotropia can be up to 7 until 18.5 times higher than the esotropia. There are many etiological factors underlying the intermittent exotropia itself, including abnormal anatomy of the extraocular muscle, loss of functional control, and/or convergent insufficiency. The appearance of strabismus is linked with a variety of negative psychosocial consequences. Children in digitally altered photographs that stimulate exotropic strabismus are rated negatively on intelligence, health, happiness, hesitancy, etc. The presence of strabismus can elicit a strong social prejudice among children and adults alike. Therefore, it is necessary to develop a deeper understanding of intermittent exotropia both in the society and for educational purpose. And through this presentation, it is hoped that we can understand the general information, epidemiology, etiology, risk factor, pathophysiology, sign and symptom, supporting diagnosis, differential diagnosis, treatment, complication, and also the prognosis of intermittent exotropia. We hope that the community will also can avoid the risk factors and do the prevention of intermittent exotropia with our information. The presentation will be continued by my friend. Thank you.
Hello doctor and friends, my name is Duna Awisi Dauruk, student number 165. I will explain our definition of intermittent exotropia or IXT. IXT is the most common form of exotropia and more prevalent among children. It is a form of strabismus or ocular misalignment in which one or both of the eyes turn outward occasionally and may occur from time to time. This condition is not constant and mainly noticed when the patient is looking in distance. The angle of deviation ranges from 20 to 40 prism diopters. IXT can have negative psychosocial consequences and associated with impairment in binocular function and stereoacuity caused by the misalignment of the eyes. Patients with IXT may experience few or no symptoms. Thank you.
Hello everyone, my name is Diai Sutari, student number 173. Moving to the epidemiology of intermittent exotropia. Intermittent exotropia is considered to be the most common form of exodeviation by ophthalmologists and is said to affect approximately 1% in the general population. Studies regarding the prevalence of this condition in Indonesia are still quite low. On the other hand, there are some studies in China that have shown similar results. The results were 70.3% and 73.04%. One study had preschool children as their subject, and the other had primary and secondary school children as their subject. They also found rural pupils had higher tendencies to have intermittent exotropia than urban pupils.
Hello, my name is Risma number 195. So there are several theories why intermittent exotropia develops. The first one is interventional and mechanical fracture due to interventional imbalance in the divergent center in the areas of the tegmentum of the brain in humans. The second one is genetic. As we know, hereditary play a role in exodeviations. The etiology of this disorder is thought to be multifactorial. Besides that, so many risk factors that will cause exotropia intermittent, such as genetic, viral infection, amblyopia, myopia, and maternal smoking during pregnancy. Thank you.
Good afternoon, my name is Jennifer Luisa, student number 018. So the pathophysiology of strabismus is still poorly understood. Ocular motility physiologically depends on neuromuscular control, which involves extraocular muscles, the cranial nerves, supranuclear pathways, and cerebral control centers. Any dysfunction related to those factors may have an effect in the development of strabismus. In intermittent exotropia or IXT, the sensory status is double, as suppression of the deviated eye alternates with normal binocular vision. It is still up to debate whether the intermittent deviation induces intermittent suppression of the deviated eye or if the opposite is true. The role of sensory and motor fusion, convergence, accommodation, and stereopsis in control of the deviation, and the part they play in the pathogenesis of IXT have also long been the subject of debate among ophthalmologists. Therefore, the definite cause of IXT is still unknown.
Good afternoon, doctor. My name is Vanessa L. Student number 121. Adults with intermittent exotropia most commonly experience visual fatigue. Eyes with intermittent exotropia need more convergence and accommodation than normal eyes to maintain binocular vision. Therefore, visual fatigue is not uncommon, and then other than that, blurred vision, headache, diplopia, loss of place when reading, and loss of focus while reading could also happen. Children with intermittent exotropia are rare in showing symptoms due to well-developed suppression mechanisms, but such symptoms like rubbing eyes, tired eyes, sensitivity to sunlight, or closure of one eye in response to bright sunlight due to reduced binocularity, panoramic vision, and blinking a lot may happen. Rubbing the eyes may occur due to ocular discomfort in children experiencing hurting in the eyes, and sensitivity in light has been suggested to reduce photophobia or diminish diplopia. Patients with intermittent exotropia usually have normal ocular alignment. A variety of symptoms may be experienced by patients with intermittent exotropia. Therefore, integrating detailed assessment of symptoms to clinical assessment must be done to diagnose and treat intermittent exotropia correctly.
My name is April, student number 237. So the examination to support the diagnosis of intermittent exotropia, the first one is measuring the angle of deviation. A prolonged alternate cover testing should be used in patients with intermittent exotropia to suspend tonic functional convergence. If after prolonged alternate cover testing, there is a significant angle variability in distance or near reading, then a patch test is indicated. The patch test is used to control the tonic functional convergence and to differentiate pseudo-divergent excess from the true divergent excess, and also to reduce the angle variability. And then the last one is lens gradient method. This test should be resorted to a patient who have the distance deviation greater than near deviation of 10 prism dioptries or more after the patch test. If by the end of this test, the exo deviation at near increased by 20 prisms dioptries or more, the diagnosis of high AC per A ratio through divergent axis intermittent exotropia is made.
Hello Dr. Friends, my name is Philip Renal Valentine with student number 06. Since intermittent exotropia is one of exotropia type, we need to distinguish it from other types. The other exotropia types are congenital exotropia, sensory exotropia, consecutive exotropia, and convergence insufficiency. Congenital exotropia is an exotropy that is usually constant and cannot resolve itself spontaneously during the first 6 months of life. Children and young children who are blind that are poorly visible tend to experience exotropy. However, typically eyes will be exotropic in children over the age 2 till 4 years and adults. This condition, called sensory exotropia. Consecutive exotropia is a type of exotropia that previously exotropia occurs after surgical overcorrection of an exotropia. The last type is convergent insufficiency. Occurs if the patient has history exotropia that changes to exotropia, but the deviation is worse at near compared to at distance. Another condition that have similar symptoms as intermittent exotropia is exophoria. Exophoria is a condition when an eye drifts outward when looking at object closely or when uneven visual stimulation occurs. Exophoria usually occurs when covering only one eye. Thank you.
My name is Tiara with student number 105. For the treatment of intermittent exotropia, it includes surgical and also non-surgical methods. However, surgery is said to be the most effective. Some indications for surgery include decreasing stereo acuity, decreasing visual control, and large deviation angle. The goal of surgery is to restore the alignment, diplopia control, and also preserve binocular function of the eye. There are two common procedures that include bilateral lateral rectus muscle recession or unilateral medial rectus muscle recession combined with lateral rectus muscle recession. Both methods have similar success rate. There are also non-surgical methods. First is patch therapy, which is done by covering the dominant eye in order to reduce exodeviation and reduce visual adaptation of the eye. The second method is over minus glasses by prescribing -2 to -4 diopters glasses in order to reduce convergence. These methods are usually done if the patient refuses to go under surgery. Thank you.
My name is Jennifer Jasmine Gunawan with student number 068. Around 15% of untreated intermittent exotropia develops into certain complications such as constant exotropia, motor deterioration, and loss of stereo acuity. Certain treatments, such as surgery, has its own risks of complications such as scleral perforation, retinal detachment, endophthalmitis, overcorrection, and consecutive esotropia.
Hello, my name is Shantriwi with my student number 142. Talking about the prognosis of intermittent exotropia, generally it has a good prognosis. Usually, intermittent XT patients will have no major vision and depth perception problems, but as the condition may vary between cases, some could develop diplopia and amblyopia. It might also develop into constant XT. Although there is no major eye function problems, if left untreated, intermittent exotropia can cause decline in quality of life, as it is reported that the patient might develop lower level of self-esteem and a higher level of social anxiety. In fear of these psychosocial problems, parents usually get their child's XT treated before they enter school life. The strabismus surgery itself is a commonly done operation and it has a high success rate. So overall, the surgery prognosis is good, but recurrence might happen. Thank you.
My name is Sukodesra Pamayun with student number 252. Intermittent exotropia is one form of strabismus or ocular misalignment, characterized by angle of deviation that ranges from 20 to 40 prism dioptries. Intermittent exotropia occurs in approximately 1% of the general population. Based on its etiology, there are three factors that contribute to the development of intermittent exotropia. 1. Innervational and mechanical problems, 2. Genetic factors, and 3. Refractive error. Visual fatigue is one of the symptoms that often experienced in adults with intermittent exotropia. Children with intermittent exotropia are rare in showing symptoms. There are several tests available to support the diagnosis of intermittent exotropia, such as angle of deviation measurement, patch test, plus 3D near-eye test or lens gradient method. And intermittent exotropia can be treated with surgery and non-surgical methods. However, the success rate of corrective surgery is high. Okay, that's all about our student project. Thank you and have a nice day.